Go ahead and get started. Okay. Good morning, everyone. My name is Desiree Jones. I'm a health educator with the University of Arizona Cancer Center with the Office of Outreach, Community Outreach and Engagement. And today on Let's Talk About Cancer, we have Sarah, who is a faculty instructor at Arizona State University. So welcome, Sarah, and may you please introduce yourself and tell us a little bit about what you do?
Great. Thank you, Desiree. I really appreciate this opportunity to talk about what I do in Tucson and about my book. So I do appreciate it. And thank you to those attending or listening later on. I actually did my first social work internship at the Arizona Cancer Center many years ago. Arizona State University has a school of social work here in Tucson. And I always knew I wanted to go into oncology, and this opportunity came up. So it's nice to be back. I worked there many years, so it's nice to be back. Currently, I educate students online who are getting their master's and undergraduate in social work. And I also facilitate a young adult support group here in Tucson. It's going on its 5th year. We meet twice a month, and it's open to anyone being treated in Tucson, including the Arizona Cancer Center, Banner, any institution that they're getting treated at, they can attend. So that's my position here.
Thank you. So how did your degree in social work lead to oncology?
So I love that question because I actually, I'm from Boston, and in high school, I volunteered at Boston Children's Hospital. And that's when I was on the pediatric oncology unit volunteering in the playroom. And oncology led me to social work. So I knew that I wanted to work in oncology, especially pediatric young adults. And I wasn't quite sure. So it was sort of a journey to figure out social work. The reason I picked social work is I really like to be with patients in the hospital during their treatments. And so that led me to social work because it felt like the best space for me to provide support and care to pediatric patients and their families.
So what does the day-to-day look like for you as a social worker in the clinical setting and working with patients?
So right now, my main job is to provide education to social work students. So I share about my experience in the hospital. I share about facilitating the support group. And I teach, the curriculum that we've designed through the School of Social Work. So, and then the support group is run currently over the past year, it's run online on Zoom, but that just meets twice a month. We used to meet at the Ronald McDonald House. When we originally started 5 years ago, we had it on the bone marrow transplant unit inpatient. That way, if people were inpatient, they could attend. But then we switched it to the Ronald McDonald House. And like 2 years prior to COVID, I had changed and admitted so that people could come and join on Zoom. So if they were immune suppressed, the young adults, if they couldn't find transportation or didn't feel well, they could always Zoom into the meeting. So we've been doing that for a few years.
Great. So do you know what common cancers are diagnosed among teens and young adults?
So from my experience, I also ran a young adult support group in Boston at Mass General Hospital. And there we did a closed 6-week group. And I had a variety: breast cancer, brain cancer, leukemias. I think from Tucson and the population that I have there, a lot of osteosarcomas, leukemias, brain. So there's a variety. It just sort of depends who comes.
Great, thank you. Do you know the signs and symptoms of any particular cancer and what parents or individuals should really look out for
So
among
I,
their.
so I guess what I would recommend is in working with young adults with cancer, I often hear, sort of how it developed and how they were diagnosed, but um, mostly just go and get follow-up. So if something is different than your norm, headache or pain in a part of a body, I wouldn't ignore it, and I would go get checked and tell your family and go see your doctor so that um, you don't have that wait time. So overall, from a social work perspective, that's what I would recommend from hearing from the young adults.
The young adult topic is so new, I think, for our group because we've talked a lot about, women's cancers, men's cancers, and they mostly affect populations that are a little bit older, and we do talk a lot about screening. So I think this is a unique topic, talking about young adults and teens, and then certainly learning more about the types of cancer that affect them. So moving on to your book, which I have pictures of here, your book talks about effective support groups or having group therapies. So can you tell us a little bit more about that?
Sure. So one thing is that young adults and teens are definitely like the most underserved population in cancer because they're either being treated by the pediatric team or the adult team, and they don't have that connection, or that they're really isolated in their treatment and their psychosocial needs because of that, because of their age. So as a clinician, I definitely was always intrigued with the young adults because they're still dependent on their parents, but they're also gaining their own independence. So it was always something that I wanted to facilitate. And I'm a contracted facilitator for the group that I created, but I was asked by Courtney's Courage, which is a foundation here in Tucson. It was actually one of my pediatric patients, and they provide financial and emotional support to families. And then Candlelighters of Southern Arizona is also the other one who asked me to create this group, because at the time, 5 years ago, there wasn't a support group for young adults. So it's definitely, I'm on some national associations, and it's definitely an underserved population. So that's why I decided to write the book and to give a voice to these young adults in Arizona that don't have a lot of resources, that live in rural Arizona. Some of them come like an hour to come attend the group. So I thought that when I was presenting at conferences or meeting in young adult, the APOS, which is social workers and doctors and psychiatrists, I went to their conference. It was actually in Tucson like 3 years ago. And I went to a young adult collaboration, and everyone was like, wow, that's so, they were impressed with how I created this group. And I thought, well, maybe I should share it, and maybe it should be a resource for young adults and for people going into oncology and providing support. So, and if you look in the research, it is definitely the most underserved population in the cancer. So the book talks about the group I did at Mass General, which was a closed group, and then it compares to the group I have here, which is more of a community. For example, we have a Facebook page where I post information, inspiration. I post things from the banner social worker, such as scholarships for education. And so it's not only a support group, they have an actual community, and that's what I'm trying to build. And that's what I share in the book. And then also, I'm very proud and honored of the young adults in Arizona, because this hopefully is going to be shared in conferences and education so that their voices are heard to inspire other young adults that they're not alone.
Great, thank you. I'm glad you talked about the rural areas, because your book talks about support groups in clinical settings. So would the support groups be applicable to like a community setting? Like if a community organization wanted to do a support group where there's lack of resources? So
Yes, and I, as a professional, as a social work ethical, I would be very happy for anyone to connect with me to get ideas. They could read my book, but I am happy to give them ideas on how to facilitate it. And, past 3 years, we've also had this group open so that if someone can't afford, they live in a rural part, they can still Zoom in. They can still belong to the closed Facebook page and get those resources. So I definitely, what I compare in the book is like Boston has tons of resources. They have incredible foundations, and Dana-Farber Cancer Institute has a whole young adult program. So comparing that and how we do it in more rural areas in Arizona. So I talk about it's group therapy, but it's also building a community for these young adults. So definitely they can contact me. They can read the book. It's also a lot cheaper, and it just came out as an ebook. So maybe that's more accessible, but they can email me, they can call me. I'm happy to share my knowledge and how to create and provide support for young adults.
great, thank you. So transitioning into another question. So do you know of any trainings that are available for those who might want to become support group facilitators in addition to reading your book?
So there's the Association of Pediatric Social Workers. They have conferences every year, so they could take a training in there. There's the adult, so young adults have through Adult Arizona Association of Social Workers, the adult and the peds both have young adult instruction. And mostly like for social workers, that experience would really come in an internship. For example, my first internship was at the Arizona Cancer Center, and I created and ran a support group for young adults who had children. And it was a 4-week program, and we provided support for parenting through cancer. So a lot of that, it happens like in psychiatrists and psychologists during their internships and their trainings. But so associations, but I don't know like a specific training that they could go through, but they can contact me and we can troubleshoot and go from there.
Great, thank you. Go along the same lines, do you have any recommendations for those who would like to facilitate support groups?
So getting some training, connecting with professional organizations such as Pediatric Association of Pediatric Social Workers, reading the book, in your education, connecting with. So for example, I really think like collaboration. So the social workers at Banner were not, didn't have the time or the capacity to run a support group. So it was something I had experience with. It was something I was interested in. So we collaborated. So we sort of worked together. They refer their patients to my group, and then I post the information. So it's about collaboration. So sort of just making those connections and seeing who's doing what and what they can participate in. And for example, I just went to a conference in MD Anderson in Texas, and it was specifically on young adults. And they share a lot of research and things that they're doing and how it's running. And because of COVID, a lot of things have opened up so that you can actually attend something at Dana-Farber Institute. And this month is actually awareness of young adults with cancer. So Stupid Cancer is a great resource online that has they have conferences, they have art, they have stand-up comedy. I mean, they have so many things, and I post all that in our website so that people can access it and use it. So I think the bottom line is collaboration and sharing what you've done and inspiring and mentoring others to start a group.
Great. So are there any other different organizations or partners that you have developed relationships with to do those sorts of collaborations?
So Dana-Farber, we are always in touch. Like they purchased my book right away because I post all of their organizational programs that they have to our group. So sort of just that professional connection and communicating. So I post theirs at Stupid Cancer. I post all their activities and things. So I think just sort of putting the information about what's already out there and who are the experts in the field and how they can help and see.
Awesome. So are there other support groups for teens and young adults in other parts of Arizona besides Tucson that you might know of?
So I do collaborate with Phoenix Children's Hospital. So we would just look on their like website, just like the Arizona Cancer Center has a multitude of great support groups. So just sort of see what is out there. But I think in Tucson, we're the only one, and we include anyone. You don't have to be center specific.
Awesome. So do you, moving into a different topic, so I know we talked a lot about helping young adults and teens and pediatric cancers. So do you also assist parents of those teens and young adults with cancer?
So in this role as a facilitator of the support group, I don't, but I do collaborate with the in-person social workers, and they're the ones who provide support. So when I was working in the hospital, I definitely provided counseling and support to siblings as well as parents. But in this role as group facilitator, it's just the young adults specifically. But my colleagues at Banner who see the patients, they're the ones who really provide the case management support for families. So that's how we sort of collaborate. I do the group and they do the clinical social work support.
Great. So we had a couple of questions come in on the chat. So has the COVID-19 pandemic impacted your work with the much needed support services?
So yes, as I mentioned before, we had already provided Zoom links for the support group. So if people couldn't financially or physically attend the group, they could still connect and come into the group. But because of COVID, I would say the first 8 months, they were definitely more isolated, and I actually added more groups. We would do yoga together. We would sometimes just have like mini sessions, meditation. So I added more in Zoom because they were so isolated, like everything stopped, obviously. So I felt like the need at the beginning was a lot greater, and I actually had to put in more sessions. And then we sort of developed a zoomed out experience towards the end of COVID. So we just went back to our regular 2 sessions. So I would say that was sort of the trend in the support. I definitely found over COVID, I'm definitely doing more like checking in individually too. So if they don't attend, just making sure they're okay and what's sort of going on.
Great. And so the second chat question is, what is the age range for teens and young adults? And do you see the need to separate teens from young adults due to maybe their personal issues, for example?
That's a great question. Thanks for asking that. Actually, so the other institutions that I collaborated with in Boston, as well as Texas and other institutions, the range chain is different. So sometimes it's like 20 to 40, or sometimes it's 18 to this, or so because I'm the only group in Tucson, I'm very flexible. So for example, if a 14-year-old wants to attend, I do allow them to attend because I feel like there's no other space for them. So if you're in a community that doesn't have a lot of resources, I think that you're more flexible in the age. This group over the past 5 years has mostly been, I would say 16 to 25 is probably my age, but I don't limit because a lot of younger people have come and they've still connected because the trauma and the experience of cancer isn't always age related. So a lot of the adolescents are much more emotionally developed than a healthy 25-year-old. So I always, and especially in Tucson, because I just want everyone to be included and get that experience. So I'm more open. And for example, my group, a lot of them are in the group for 5 years. So they're over the age of 25, but they're still included because they've been a participant. So long answer to a great question.
Great. Sorry, looking at my
I know I'm highlighting them off too to make sure I say everything.
I do have a question. Hello, Sarah. My name is Gabriella. I'm also a part of the team here, and I was listening in, and I couldn't help but have a question for you in regards to what we were previously speaking about. As in, what advice would you have for parents who may be going through this challenging time? You have such a plethora of experiences and knowledge. So, what do you think would be most important for our community members to know?
Did you say parents specifically? Yeah. So when I worked in pediatric bone marrow transplant, I learned so much. First of all, those parents are incredible because watching your child go through treatment is probably the most demanding emotionally and physically, because, you know, that's your child that you love and you're taking care of. So it's definitely a hard emotional process. I would definitely say utilize the social workers because they're there for you. They can meet with you one-on-one. I know, you know, just sort of, there's a process of just surviving. Like you can't even like go eat or take a shower or take a break, but it's really important to take those breaks and to find that support. Also, connecting with other parents really helps. I remember another colleague and we kept talking about the parents and we're like, you know what, let's start a group for the parents. And we did. And then because I was always saying, well, I learned this from this parent, this is what helped them. And I'm like, why am I saying it? Let's bring them together so that they can get that support and connection. So a group for parents, definitely take time for yourselves if you can, and use the social workers because they're there to support and listen to you. Thank you for the question, Gabrielle.
Thank you, Gabby. So I know you talked about their support groups in Tucson. So do you have any specific links where people can go to search for support groups?
So the Arizona Cancer Center has a link under, I think it's under social services, and then they have a list with a calendar of all their support groups.
And that's under the Banner site or the Cancer Center?
I think it's under both.
Okay.
And it's on, if you go to social work, they're under both of them. I haven't looked recently, but and there, every team has a social worker. So I definitely recommend anyone going through this to connect with the social worker because they might know more up-to-date information. But they, last time I checked, they definitely have both of those resources there. I don't know. I don't think there's a parent support group. I do know that Courtney's Courage does, they used to do pre-COVID a monthly get together for moms, and they would just like provide dinner and the social worker would attend. And so there's some great things happening in the community for parents to provide support for them.
And just a follow-up question, there was a question in the chat. They would like to know how to refer individuals to your group.
Okay, that's a great question. So I have hopefully I'll give you my email. And usually what I do is I give you my email and my phone number. And then the individuals email me questions, or some people just don't even attend the group, but they are on the Facebook closed page because they want the resources. So if you just email me or call me, then I will connect with them, answer any questions they may have, and go from there. And I'll put my information in the chat. So
Yes. And then I also added your email at the end of the slide. So
Oh, perfect. Okay.
yeah, we'll get to that. So can you talk a little bit about the benefits of support groups and having that sort of resource available as you're going through this challenge, as an individual may be going through this challenging time?
Yeah, there's a lot of people, like recently I had a new participant attend, and she kept saying like, oh, it's the social worker recommended it for a whole year and I finally came. It's a hard thing to sort of allow yourself to try because it's sort of scary or you don't know what to expect. So, but the benefit is so incredible because the young adults are such an isolated, underserved population. They have so many more emotional needs because they're sort of missing out on their job, their schooling, their life. So they have like a pause. So they're some of the emotional stuff that happens when you're going through treatment, you're just surviving and you're not maybe going through the emotional part. But like some of my group members have been cancer free for 5 years and they still attend my group. That is profound to me. So like a lot of things come up later. And then in the past year, I've had a few group members who came like the day after they were diagnosed or the day after they had surgery. So, every journey is different. I think the benefit of a group is incredible because it's building community and it's building something no one else understands, not even maybe their parents or any of their friends, because cancer and treatment of cancer is so isolating for young adults. And it's to find like that connection is just magical. And for me to be able to facilitate the group, the connections that are made in a group are so incredible. Every session, they provide support to one another. They encourage each other. They just validate the experience that the young adult is going through. And for me as a clinician, I learned so much in facilitating the group. Just like I said, like the parents, we kept seeing these themes of parents and we're like, wait, we should do a group. And they got so much more support than they did individually. So it sort of complements individual social work support, but it's really just about building a community and having someone to like relate to, like to know what it's like to look different or, and especially as a young adult when you're forming your identity. So there are so many benefits. And just the fact that I have young adults who are in survivorship and they still attend, that makes me feel like this is effective treatment. And there's research out there to support the magic of support groups.
And Sarah, I'm curious to know, through the trajectory of your career and all of your experiences with these individuals, what have you seen as a successful or positive way to deal with the grief associated with a cancer diagnosis? And with granted, every family, every individual's case is different, but what have you seen that's been most helpful?
So one thing is providing the group, like the fact that they can come in with a like really urgent issue, such as they have to go in for a scan because they might have seen like their counts are off and they might be scared that they have a relapse or something. But they can come in and a new person can come in and they can like put that aside and provide support to another. So like them attending group isn't just they're getting from it, they're giving. And they like that. They don't always like filling out. I do a pre evaluation and a post evaluation every group, and they always would complain like they don't want to answer my questions. But look at, we have a book that they wrote and they are inspiring others throughout the country. So it's called like post traumatic growth, like the experience that they have and them sharing that and maybe inspiring someone else, that helps in their grief. Feeling that connection that they can't share with their friends because their friends don't know what it's like to throw up for 48 hours and be so sick you just want to die, and like someone else like, oh my god, I felt that too on that. Like that connection brings some validation and some significance to what they went through. So does that answer what you're sort of experiencing?
Absolutely, absolutely. And we also have another question in the chat, and we thank you all for adding your questions for our guest speaker. And this reads, can you discuss some of the permanent challenges or issues that this group has to deal with, such as dating and sexuality, for example? Can you tell us more about that?
Yes. So that's definitely something that is prevalent through the young adults, their experience with getting into a relationship, because maybe they had cancer their whole high school experience, so they never had that first boyfriend or girlfriend or significant other. So there are a lot of things like social skills that they're sort of lacking because they were in a hospital for a whole year and didn't have that connection that they're supposed to be experiencing. You know, for some, it's given new direction and light in their life, having cancer. Like they seem to find the positive and what it put meaning to the cancer and what they're going to do. A lot of them have this tremendous post-traumatic growth where they will raise money for others or they'll do something for others, which is just incredible. So I'd say like social skills, fertility is definitely something that comes up. You know, when to share your cancer story. If you're 5 years out and you don't appear that you have cancer, when do you share that with new work, new friends, moving on? How do you balance that sort of when a trigger comes up or something, or a scan comes up? How do you still live a normal life while experiencing that? So it's definitely complicated, but I would definitely say social skills and just sort of grieving the loss that they had, the loss of life during that time of getting treated. I hope.
Absolutely.
Thank you for the questions,
and
for those of you participating, and keep them coming if I'm not answering them correctly.
yes, absolutely. And even on our social medias, we're also streaming this. So thank you for your questions. Sarah, I wanted to bring up, I think it was a great detail that you shared with how and when people feel comfortable sharing their story and their experience. I can't imagine that is ever an easy conversation to communicate. So I think that was very powerful that you added. Thank you.
Yeah, and I try to I do those evaluations because a lot of times they want to learn certain things like mindfulness-based stress reduction, or they want to learn communication, or learn some of those skills that can be provided in a group, and to share that. So for example, I mean, I've been in the field in oncology for many years, 20 years, lots of experience, but just 3 years ago, I was trained, it's a National Cancer Institute, and it's called Bright Ideas, which is just basically teaching cancer patients problem solving. And it's such a basic development, but I've incorporated that in my group, and we sometimes go through the forums and I teach them how to make those decisions on their own without depending on like a team, or like just giving them strengths and skills. And you know, one day they might want to do that and one day they might just want to talk, but I always have a plan and an agenda. And I do that evaluation because they know what they need to make it through, and I try to provide that support for them and with them, because I learned just as much. It's just an incredible experience, and I feel honored to be able to do this. And in saying that, also I share the confidential, I don't share, you know, any specifics about it, but I do share like my experience to social work students so that they can think about how chronic illness affects developmental stages and progress and different things that they're learning in the book. So I think my balance of educating, then I feel like, well, they're going to go out and work with cystic fibrosis patients or cancer patients or abused children, and I'm giving that, and the young adults are giving me that to share with them. So.
Great. That just reminds me of self-advocacy, which we talk a lot about. And we are going to have we have a Beyond Cancer series that we're planning, and our first topic that we're going to be talking about is self-advocacy and cancer survivorship. So with that, I wanted to ask, do you have any advice that you would give to a teen, young adult, maybe a parent, caregiver, or family member who has recently had a diagnosis of cancer, of a cancer patient? Do you have any advice that you would give them?
Be true to themselves, like take care of what they need, because it is a survivorship. Some people can't deal with the emotional part right away, and that's okay. That doesn't mean they did it wrong, or, if you don't join a support group, that doesn't mean you're doing it wrong. It means that you're surviving it, first of all, and then you're doing what's right for you. So seeing what resources are out there. Someone might not want to attend a support group, but they might want to listen to this lecture. That's okay. Like, they have to do what's right for them. But there are great books out there. I just finished I can maybe post it to you later. It's Between Two Kingdoms, and it's a young adult sharing about her experience, and is pretty incredible book. And I think she was a speaker in one of the conferences I went to. What I love about anyone in oncology, anyone who is providing support to families, is we all work together, and we all have that common need to support people through. So there are resources out there, and just sort of listen to yourself, do what you need to survive through. And that might be meeting with a social worker and getting therapy. It might be listening to others who have been through it. It might just be getting your own journey. So I don't have a specific secret, but other than be true to yourself during this really hard time. And there is supports and resources out there if you need them. That was a hard question.
Great, thank you.
Mm-hmm. And also just popped in my mind is, if you don't want to attend a group, but maybe, I've had some new members come, and then none of the veteran members come, and they will share with me, which I think is pretty profound. Or maybe you ask your social worker, hey, I don't want to go to a group, but do you have anyone around my age that would be willing to talk to me or text me and sort of share? There's other avenues of support, and you can sort of, I know when I was in the hospital, I would do that, like connect patients to each other. So they didn't have to go to a group, but they felt that connection to someone who's survived through it.
And in line with that, Sarah, one of the many goals that we have within our team of community outreach and engagement is to really support rural areas. Mm-hmm. So what types of steps would you recommend for support groups for these communities in particular who may not have enough resources?
So a collaboration. So maybe like touching base with me and seeing if they could have access to my closed Facebook, where they can get resources for financial support, or connect with some community like Courtney's Courage, who provides a lot of support to our patients. Asking them to provide a meal for a group. There's maybe a social worker in the rural area that wants to do a group, but they don't have the resources to get, a meal together, or something, like sort of collaborate and problem solve together. And I think, one advantage of this past year has been that, I attended 3 conferences on young adults 2 weeks ago, all virtually, which I wouldn't have done if it wasn't that circumstance. So like the connections are there. even more so. And, like you said, like making those connections and resources. And anyone in oncology, as you know, we want to help each other. Like I wrote the book so that this can be at every institution in the United States. This is my second book, and the first one was I interviewed my families who went through pediatric bone marrow transplant, and then we passed it out and it had like just their words, and we passed it out to every pediatric transplant for free in the United States. Like that's incredible, like that they have a resource and something that they can take with them. So I think we always want to support and guide and anyone providing care.
That's right. Yeah. And we also have a follow-up question, a really great question these have been, and it reads, how do you see meeting the needs of various ethnic populations?
That is a great thing, and it's actually a limitation of I think this group, because I don't speak Spanish, I don't speak another language, so that's can be difficult. It's definitely something I need to improve on, but I do think overall we welcome in my group, any ethnic diversity, I think, into the group. And we learn from the different ethnic groups, definitely. There is research out there that talks about it, but it's definitely something that is more relevant. But anyone is welcome to our group. But there is the language barrier, but we could get, I haven't had the need right now to get a translator or anything. So, but we definitely learn a lot about the participants' ethnic backgrounds, and we are very open to everyone coming to the group. So thank you for that question.
Great, thank you for sharing. I think that's the end of our questions on our end. Oh, I see that we have another question in the chat. So are you seeing a diversity of participation from Native Americans and other groups? And do you have like sort of a breakdown of that?
I don't, but that's a great question. We actually, when I worked in pediatric bone marrow transplant years ago, we were the only transplant in the whole Southwest. So a lot of our families would come from the reservation to have their treatment because we were the only center that did that. We'd have families from Phoenix. So we had a lot more diverse population. I was running a parent group then when I was working in the hospital, and we had a lot of diversity there. I would say we have a good mix of ethnic in my group over the past 5 years. A lot of natives to Tucson, a lot of ethnic Hispanic background. But that's definitely something as a limitation in terms of it isn't something I've focused on, because I just sort of open it to anyone who wants to participate. But that's a great question and something that I'm being more attentive to.
Great, thank you. We do have a Twitter trend of our webinar. So if anyone wants more information, we definitely tagged Stupid Cancer, and we also linked the Cancer Center for the support groups and more education in the Tucson area. And so with that, I'm going to go ahead and talk about our upcoming webinars. And if anyone has any more questions, feel free to continue to put them in the chat or tweet us. So we have a little bit, here's some of our upcoming webinars that we're having. So our Let's Talk About Cancer next Tuesday, we're going to have Jamie Aiken and her cancer survivors talking about ovarian cancer remission, and they are with the National Ovarian Cancer Coalition. The Friday, we are having Dr. Julie Bauman with the U of A Cancer Center, who will be our morning cat chat speaker, and she'll be talking about the head and neck cancers. And then 2 Tuesdays from now, on April 20th, we will be talking about testicular cancer with Dr. Rosario Boles. And I talked a little bit bit about this, we are having our Beyond Cancer series, which is aimed toward cancer survivorship. And our first guest speaker is Mindy Griffith from Bagot, who will be talking about self-advocacy and cancer survivorship. So certainly join us for that. And then our last let's talk about cancer guest speaker is April 22nd with Mr. Jose Rivera Tenori, who is a prostate cancer survivor and will be talking about his experience with prostate cancer. Yeah, so for those of us who joined us for the webinar, we certainly put up the links for our COE listserv. We send out a monthly newsletter. You can register for our morning cat chat with Dr. Julie Bauman, as well as our registering for our Beyond Cancer. And we would really appreciate it if you fill out our evaluation to let us know what more we can do, critiquing us and our Let's Talk About Cancer. So certainly fill that out. And then again, here's your contact information. I went ahead and put your email address below. So if anyone has any follow-up questions or would like to talk more with Sarah about young adult teen support groups, there's her contact information. And we also do monthly drawings for those who fill out the evaluation. And the link can be found below, as well as the QR code. And don't forget to follow us on social media.
Yeah. Well, thank you all for this opportunity and all that you do in the community to provide education and support and connection, which I think is really great too. So thank you.
Great. Thank you. Thank you for joining us today. I think that's it. There's nothing coming in on social media, so.
Thank you, Sarah. Thank you for being here.
Thank you. You're welcome. Thank you for the opportunity. If you have any follow-up, just email me or contact. Thank you.